Dr. Mora here. Just want to show you this line drawing and help you understand the surgery that I did today. Today I did a subscapularis repair. Subscapularis is found in the front of the shoulder. Let me give you some perspective. This is the deltoid or lateral shoulder, the arm, biceps muscle, the biceps tendon, which is at the top, right next to the subscapularis tendon. Subscapularis tendon right here, subscapularis muscle right over here, glenohumeral joint. So this is the front of the shoulder. This tendon right here, subscapularis tore, so it tore off the bone. So it tore off the bone. There was a gap or a space right here, and it also led to the biceps subluxating slightly internally like this. That's typically what happens. You get a subscapularis tear, fraying. You get biceps pathology. The pain is always in the front of the shoulder. It hurts when you pull in. It hurts. So if you have a full thickness tear like what I just did here, that means that the whole tendon pulled off the lesser tuberosity. It's a little easier to see on an MRI, but usually it's just the upper border, which oftentimes is missed on an MRI. So you have to have a high index of suspicion. And once again, suspicion is raised when patients say, I have pain in the front of my shoulder, and then you push on that area and they say, ouch, or they have weakness with internal rotation. These are challenging to repair because once they tear completely, like this diagram here or this line drawing, then the pull, the muscle belly, it continues to pull. And as it continues to pull, the stump moves farther and farther away from the docking site, which is right here, the lesser tuberosity. And it can actually end up at the level of the joint, which is over here, the glenohumeral joint. And once it gets to this level, this muscle has fibrosis and shrunken, and it's lost elasticity, so it's much harder to pull it and reattach it. And the other factor is the angle. The angle that we work to repair this is a challenging angle during the surgical procedure, because we have to sort of pull in this direction, in contrast to a rotator cuff, your classic rotator cuff, which is over here. It's a much easier angle to repair. This is how we do our suturing. Before we suture, the lesser tuberosity is roughened up, punctate bleeding is created, the frayed edges are cleaned up so that the stump is a little bit cleaner at the edge, and then sutures are placed into the stump. Once the sutures are placed, then we place the sutures into anchors that will tension those sutures to pull the subscapularis in up against the bleeding bone and compress it. How are those sutures placed? They're placed like this. I just did a drawing. I drew the subscapularis sideways. I drew it sideways because this is actually how we operate on the patient, sideways. Sutures are placed like this. These are doubled up sutures, so let me see if I can just draw another one. Let's just pretend it's over here. Another suture goes in, doubled up like this, and then a loop is created, goes around the loop. So when it's pulled like this, boom, it locks it in. These are interlocked sutures, very difficult to actually rip out of the subscapularis, and then these sutures are placed into an anchor, tensioned, and locked in.